Welcome back to the Beltway Boys. Hot story number 2, the H word. Not referring to health care. Well, I am sort of, but it's really Hillary Clinton, Senator Hillary Clinton, wife of former President Clinton. In any case, she announced her new health care plan a couple days ago, making the point that it's vastly different from her health care plan that she drafted back in 1993 when her husband was president. Well, it's a little bit different. It's not fundamental change. All it does is just involve government more in the whole health care system than it was before. No, it does. It involves government more. Please, Mort. You haven't read the plan, even though there are a lot of blank spaces.
Less than in 1993.
Well, less than 93,
yeah,
but more than now.
Yeah.
Okay, good. We're on the same wavelength. Anyway, here's Hillary. Listen to her.
I know my Republican opponents will try to equate health care for all Americans with government-run health care. Well, don't let them fool us again.
She ought to watch out for that whiny tone when she takes it. It's not very appealing. Anyway, look, I have a 3-part test for people's health care plans. Does it make health insurance and health care more accessible? Does it, in some reasonable way, restrain healthcare costs, which have been spiraling upward, and does it maximize the choice for patients? Well, Hillary fails on 2 and 3. Certainly there are no cost controls, and certainly doesn't maximize patient choice at all, but it does make health insurance accessible to everybody by federal mandate. Nonetheless, you know, despite her past and so on, she has a lot of credibility on health care with the public, to my surprise. You know, when asked if Clinton's prior experience with health care reform helps or hurt her, 66% think it helps her. That's probably, are you in that group, Mort?
Yeah, I am actually.
Yeah, I thought so. That number jumps to 77% among Democratic primary voters.
Now, look, this will help lower health care costs insofar as it's a mandate that covers everybody, including young single people who think that who are now going without health insurance. You put them in the pool, and it lowers the average cost of health care for everybody. Just secondly, there are a lot of choices available under her plan, a lot more choices than there were in 1993. The worry would be that one of her choices is a Medicare-style plan that you could buy into, and if, depending on how the plan is written, you could have everybody flooding toward there, and then you would be heading toward government-run insurance. But look, the fundamental problem here is that we now have 47 million people who have no health insurance. That's up from 38 million when President Bush took office. We've got almost 9 million uninsured children. The employer-based system is collapsing bit by bit.
Get rid of it.
No, wait a minute.
She doesn't.
But except that what it's doing is throwing people off of health insurance. And wait a minute. And President Bush has been in office now for almost 7 years and has done nothing to make any kind of substantial dent in that continuing problem. And meanwhile, costs are rising, and he hasn't done anything about that either. And I think in a massive act of political stupidity, he is going to veto a bipartisan S-chip, children's health expansion that would provide health insurance to more poor children. Watch him at the press conference.
Their vision is expand the eligibility so that people making up to 80 will be eligible for this program. I believe this is a step toward federalization of health care. I know that their proposal is beyond the scope of the program, and that's why I'm going to veto the bill.
There are very few children around the country who are in the $83,000 bracket that are going to get S-chip. I mean, there are people in a few states, and they were allowed to be in the program because the Bush administration allowed them to be there. Now, look, his proposal, $5 million over 5 years, billion over 5 years, would cover fewer children than are now covered. In fact, like 1.4 million less children would be covered under his proposal than are even covered now. And you know, he had in his budget a $2 million program in past years to expand coverage of kids under 200% of poverty who are now not enrolled. It's not even in the budget anymore. I mean,
if they're under 200%
on the wrong side of this issue.
If they're under 200% of poverty, you know what that means? It means they're poor.
Yeah.
If they're over 200% of poverty, that means they're not poor. It means because the 200% is roughly where the median household family income is in the United States. And so above that, most of those children, the vast vast majority, 4/5 or more, are already covered by private health insurance. So what this Democratic proposal would do, it would lure them away from private health insurance, which we want to expand, and put them on government health insurance.